when you're inputting patients, you want to go to officeally.com. Now, Office Ally, all you do is you're going to go into login, hit login. When you first put in patients, you want to go to Practice Mate. Now, I will give you the access codes for that. That changes every 2 to 3 months, so then I'll have to update it every 2 to 3 months. So don't worry if you can't get in it, then you text me and I'll give you the new password, or usually I just send you the new password. When I can't get in it, I have to set up the new password. So anyways, so you go to login, and typically, for me, everything's in Google, so everything's saved, so whenever I change it, I update it, so I don't have to worry about knowing it all the time. But do it however you want to do it, because your clinic will have your own computer and your passwords in there, however you want to do it. I never log into that or check it or anything like that. But anyways, so you go into login, put in your login for that, for the Practice Mate. Okay, so then you hit continue, and now you're in the system. So as you can see, we're in Practice Mate. So when you have a new patient, what you're going to go to Manage Patients. You're going to go to Add a New Patient. So what I'm going to do here is just put test. So I'm going to put test. First name is test, last name is test. Okay. Then I'm going to put a date of birth. I'm going to put mine 04/12/1969. Okay. Then you're going to hit male. Let's just put male. The weight's going to be, let's just put 200. Then we'll put a height of 6 foot, which is going to be 72 inches. You always put the inches in there, not the, you can't put it any other way. Then we'll put this person as, usually I put other, but you can put whatever if they're married, they're single, however you want. I just default to other. And now in this age, I just don't want to make people pissed, so I just put other. So we're going to put their address. Let's put mine, 1422 Coretta and northwest. Okay. So we do that, put all their information, city, we're going to put Atlanta. Okay, GA 30318, good. And out of all these, put their cell phone number, 770-321-7545. And then what you're going to do is put their cell phone number and then put their email address. So I'm just going to put, I'll make up one, okay, I'll put drtest@gmail.com. Okay, so once you put in that information, that's all I care about. So what you're going to do is scroll all the way down, and then what you're going to do is add patient. Okay, so now the patient's in the system. So you want to go to appointments, say they got an appointment, let's say, what you always want to do is put the office that you're in. These are offices that we have. So typically I'll choose an office. Right now I'm in Duluth, so I'll just make something up. I'll put it in Duluth. Okay, and then I'll say I had an appointment this morning at, let's say, 8 a.m. Okay, so hit add. Then what I do is I'll put their last name in, so I'm going to put test. Okay, boom, there's our patient, test. Okay, so then you always put on here, the provider is going to be Gemma Lindsay, always. Okay, no matter what clinic you are at, always Gemma Lindsay. Then you can put the reason for visit. Here's some reasons for the visit. Either select consultation, or if you know that they're going to do phentermine, which you know because you already did the consultation, you're just inputting them, and you already took payment. Maybe you took payment, maybe not. However you want to do. But anyways, whatever program they choose. If they're going to do phentermine, then you're going to give them an exam, EKG. What other things? If they're doing HCG, then you're going to do a physical exam and an EKG. If they're just doing coming in, they already had their EKG done, and they're bringing in their EKG or whatever, so you don't have to charge for the EKG. So it's physical and start HCG or start something. Now, if they're starting on peptides, what I do is just select consultation. So we'll just select consultation. So after you do that, it does everything for you. All you gotta do is update. Now it updates, it puts them in the system. So once they're in the system, here's where you're actually going to input exactly what you did with them. So you go to billing information, then you select code of overweight. Okay. Then what you want to do is scroll down a little bit to CPT code. So here's where you input whatever plan that you put them on, whether it's tirzepatide, whether it's HCG plan. Every service that we have is in here. So you just got to find the service and choose the program. So for all intents and purposes, we're going to say, let's see what we got here. We'll do, let me see the 5. Okay, so we'll do the 3-month special of the semaglutide, which is $822. It could be $825. So next thing you know, we're putting that in there. So we select it. Now, once we put it in there, we have to have a pointer, an ICD-9, ICD-10 pointer that says what's the purpose. This pointer is the same thing as what you put up here. So you're going to put a number 1 because that's the only thing up there, and that's in the number 1 category. So now it ties it to the weight loss. Now once you're done with that, all you do is update. Boom. Now the visit's in there. Now what you want to do is go back to that appointment, because now you obviously took payment, so you want to put in the payment. So you go back to that office, you see the person's name, test, you click on their name, you go to visit history, and then you click on the visit, and here is where you're going to input the money that you took from them, because you charged them, let's say, through the credit card. So what you're going to do is hit record payment, hit process payment, then whether they gave cash, check, charge, whatever. So boom. Then you're going to input the $822.00, the money that you took from them for the service that they did. I'll scroll up just a little bit for that service because it's right there. And then all you do is submit payment and just wait, because now you got to actually attach it. Okay, you got to apply it. So here's apply, here's a pen. What you're going to do, click on that, go to here, put in the payment that you took, $822.00 for that particular program, and then you're going to hit apply. Boom. Now you're done. In the next video, we're going to show you go from PracticeMate into the EHR. Okay, so now you already put them in PracticeMate, you took the payment, everything's zeroed out, boom, it's a record in there. Now what we got to do is we have to input the patient into the EHR. Basically what that is just saying everything that you did. So all we're going to do is go back into the login, go to EHR 24/7. Good. It's going to take you to the login. You always want to use Buckhead MS7. That's my nurse's login. So now you are the nurse. So we're going to hit continue. Now we're in the EHR. So you go to patient charts. Now you're going to look for the name. So you put in last name, which is test. Boom. Oh, we got test right here. Hit on that. Now what you're going to do is go to progress notes, and then you're going to hit custom note. Now, once again, you're back. You got to choose what office that you did it at. We did it at Duluth, so we're at Duluth. Then we're going to hit the provider's name. Always, like I said, Gemma Lindsay is the name. Now we have a guideline here. It's going to be weight loss, always for weight loss. So you hit weight loss, and it provides a template. Okay, and I'm going to show you a different way of doing this. But what you want to do is always click on I want to lose weight. Then what you want to do is in your computer, I'll email this to you, but you want to go into HCG notes for Office Ally. Now here there's templates, so you just click and paste. So let's go back to the notes. So we hit already for the chief complaints, I want to lose weight. Now history of present illness. What you're going to do is go into notes for Office Ally. You're going to go to patient is a 64-year-old female, blah, 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 blah. And you'll be getting this as an email, this template. So all you're going to do, go to patient is a 64, whatever. You're going to copy it. Then what you're going to go back into the history of present illness and paste it. Now you got a template, but not everything's the same on the patient. Here it says 64, but really the patient's 55. So this is a template, but you got to change it into this patient. So what I'm going to do is go to that 64, get rid of that, put 55 because that's the age of the test patient. And also this always goes to female. So remember, if it's this is female and the test is a male, well, now we have to address it as a male. So what we're going to do is take the female out and just put male in. And you want to do that for that whole section right here. So let's go ahead and do that. But also, male that has been a history of being overweight for X amount, it says 8 years, maybe it's 5 years, so adjust it accordingly, ask them how long they've been overweight. And it says her weight, well, we got to change it to his weight, okay? And his weight, we said, was 200. It says on here it's 231, so just X out those, and then 200. And she, well, we got to take that she to a he, and wants to be, let's say it's 200, say this person wants to be 160. Okay, so we'll leave it at 160. We got to go back to changing this she to a he, so we change that out. Let's try many weight loss options and that have failed. Body fat percentage, and the body fat percentage, we get that from the sheet of body fat percentage. So let's say the body fat percentage was, let's say 45%. So now we put 45%, and it's also beyond poor. That's all you have to do on that. Now we scroll a little bit down. Okay. Denies use of any medications. If they're not on any meds, click on that. If they are on meds, list the meds right here and the dosage, what they're taking. Okay. So if this person were to say, he's not on any meds. So then we're going to use weight, which we said was 72. His height is 72 inches. His weight is going to be 200. And we obviously take the blood pressure on every single patient. We've got to input it. So we're going to put 130 over 60. And then we're going to see the pulse is going to be 72. Then we always hit in the physical examination, which is right here. I'll scroll it up just a little bit. Okay, so we always hit from this all normal, and then we add. Now, test results. If we're doing an EKG, what you want to do is say they're on phentermine. Well, then you just put normal. Okay? That's all you have to do for that. If they bring in their labs and their labs are normal, then put it here, normal. That's it. That's all you have to do. So then we scroll down a little bit more, because now what we're going to do is we're going to put in their ICD-10 codes. Remember, this is always going to be overweight. Then we got to put in the program that we chose from, which is the program 3 months of the semaglutide, which was 822. Click that. Then we also, remember, we got to put the pointer to what that service is for, which is for him to being overweight. So then we put a 1 right there. Then we scroll down. Now, care plan. Well, we're doing the semaglutide, so we go back to our cheat sheet, which is the HCG notes for Office Ally. And we have this little template here that says semaglutide, 4 preloaded syringes, 25 units, inject in belly fat once a week. So we're going to copy that and paste it in the care plan, because that's what we gave them. But we're going to adjust it accordingly, because, say if we did give them the semaglutide, well, we got to put the dosage in there. It's always going to be 4 preloaded syringes. Okay, so he's under 200 pounds, so we might just start off with the smallest dose, which is going to be 2.5 milligrams / 25 units. Done. Injected belly fat once a week. Now, once we do that, we're going to go patient instruction. Well, we got more cheat sheets for that. So we go back to the HCG notes for Office Ally, scroll all the way down. We also have for the Mounjaro and the Retatrutide. Scroll all the way down. This is one's for phentermine and things of that nature. So we go down to, okay, this note has to always go on a GLP-1s. Patient was educated on proper nutrition and exercise and the importance of solving the root cause of her or him being overweight. Allow this and how the medication will help her, and she must do her part to solve the problem. Continue with diet and exercise as instructed to prevent muscle tissue loss. Patient was instructed to increase their protein intake, because GLP-1s typically cause muscle tissue loss. You want to be that to be on there. And then return in 1 month from is the RTO for 1 month. So then you copy that, and then you go to paste it in patient instructions, and boom. Now this note's all done, and you're good to go. Hit update. Boom. Now the office visit's created, and you're done.